to, I can't believe already, the last moment of the summer season. We're going to have a lot planned for the fall. We're very excited. I know many of you are familiar faces, so I won't take long with the whole spiel, but I just want to say thank you so much for being part of this incredible, I think, landmark series in continuing education. It really is the launching pad for a lot of the exciting work that we're going to be doing coming up. I was just filling Dr. Shridharani in on some of our initiatives, and truly, the future of adult education at the Performing Arts Center is really two-pronged. It's going to be about performing arts experiences for adults. So starting in the fall, please look for 2 classes, Sip and Sing and Sip and Speak. Focusing on the singing and the speaking, not so much on the sipping, but there will be sips. Yeah, we'll have curated, we'll have curated wines and drinks to loosen you up a little bit for singing and public speaking. So those will be really great programs that will be happening in the fall. And of course, we're going to be continuing our moments. So really, it's about performing arts for adults, but it's also about what we call storytelling for adults. It's how we express ourselves. You know, for many of us, work is meaningful. The work that we do is meaningful. It's part of our story. So, you know, we're going to hear about expertise in a certain field, yes, but we're also going to hear about the background of our speaker, how he came to be part of this, what is his story. So we're going to be providing a lot of educational opportunities for people to explore different fields, try things out, and of course we're going to continue our fabulous moments curated by the incomparable Colette Lettieri, who is just so great at picking out things that people are interested in. I mean, those of you who've been here to one or more sessions, you know, right? It's been really interesting topics and great speakers. So we're going to continue that, and again, we thank you all for being part of it. And without any further ado, I'm going to, yes?
I just want to thank you both for
Oh, yes! Our pleasure. It's really been our pleasure, and it's been so great for us to be able to connect with all of you, you know, so we're so bogged down, you know, Colette's a mom, and I work with kids so much, it's really nice to just be with adults for a moment. So thank you again, all of you, and Colette.
Thank you. So, Dr. Shridharani, who's also known as Dr. S, specifically in my house with the girls, because it's way easier, rolls off the tongue, has been our guest all weekend, and I've been talking with him about the importance of the Performing Arts Center and this piece, which steps away from the theater, but really has become an opportunity to network, to become informed, to meet professionals who could really guide us to making some of these decisions, you know, whether it was Teresa with thriving after breast cancer, or Charisse with how to get a more natural, radiant look via makeup. And as we ended last week, we said, okay, for those fine lines and wrinkles that maybe need a little kiss of Botox, as we said, or a filler, we were going to end the moment this season with having Dr. S come in. And I'm so honored that he took the day off of work and is out here with us today to, like I said, to network and to educate, to help you maybe make an informed decision as to a simple procedure that you may be debating, or a family member, and going forward from there. So if you would, Dr. S, tell us a little bit about who you are and your journey in becoming a doctor.
Sure. Well, thank you. First of all, it's really an honor to be here. And now that I know that there's a sip and sing and all of these on the horizon, I imagine there's like a tipping point where like the singing gets good with so many sips and then the rap and then starts
That's right,
So I think you're gonna have to just like find just that right balance point before the singing quickly becomes, you know.
And no judgment.
But at least, yes, there's no judgment, so that's right. But at least it's not a sip and stitch, which would not be good at our institution, or a sip and syringe. Also not a great idea. So you curated a really great program, I think, for the sipping and singing and the sipping and speaking. But no, first of all, thank you guys so much for taking time out of your schedules to be here. I love to educate. It's part of my private practice's overall tripartite mission. My practice's name is Luxurgery. We fundamentally believe on being the confluence of luxury and aesthetic surgery, because there is just so much misinformation out there as we've been talking throughout the weekend. I've had a really wonderful opportunity to get to know Colette and her family, and I always thought that you were such a dynamic individual as we've gotten to know each other from the perspective of me being your doctor. And then I saw how amazing of a mother you are, and how intelligent and and hardworking you and Rocco are, but then how focused you are on your kids. Not to mention too your nieces that are here. It's just been a full house. So it's been a lot of fun. I'm not married and I don't have kids, so it's been like but I have a lot of friends that do. So it's just been a lot of fun in general to be like to be spending time with you guys. But what you're putting together here is really unique because it's a special time in medicine. It's an incredibly, confusing time in aesthetics in general because there's so many things happening and so quickly. New injections, new technology, new treatments, all sorts of different individuals performing those treatments, and there becomes so much misinformation. So I've had the privilege of lecturing all over the world in launching certain new aesthetic treatments, partnering with Allergan, for example, that makes Botox and Juvederm and Kybella, which we'll talk about. We do research in our practice. We do all sorts of different things because we really want to be comprehensive in our approach to understanding medicine. So a little bit about my background. I grew up in the Midwest. My dad's a cardiologist. I have one brother. He's a spine surgeon. And mom is definitely, and mom works harder than everyone because she had to deal with all of us. But she helped with my father's practice. And what's really funny is we're so close that I asked my parents to move to New York to be part of what's happening in my practice, which we've been able to cultivate and grow very quickly. So we were talking actually as every quarter comes along, we're doing taxes or different things like that. At a time in my life as being a completely grown adult who's probably doesn't want his mom to have a lot of oversight on his life, all of a sudden she's like, 3 a.m. at Lavo, I don't know if I can write that one off. And I'm like, but I got a breast augmentation out of it. So I have to be very, very well behaved because my mother unfortunately does my bookkeeping. So she knows what's going on, so I'm very well behaved. But we really had a mission in mind. I finished med school really early. Out of high school, I got into a 6-year honors bachelor MD program. So I finished at 23. Straight from there, I was accepted to Johns Hopkins plastic surgery program, where they have an honors accelerated plastic surgery track. So I was able to become a plastic surgeon by the time I was 30, and then was accepted to. I want to do aesthetic plastic surgery and focus on that because I had all this reconstruction background. 7 years in Baltimore at Johns Hopkins, I was on a face transplant team, a hand transplant team. We ran the regional burn center. We did all the breast reconstruction. So I had a very strong foundation in complex reconstructive plastic surgery. But in my chief resident clinic, if you asked me to inject someone with Botox, I would have had a panic attack. Because Baltimore was a very fundamentally strong reconstructive practice. So I could put someone together if they'd been through a windshield, but I didn't really know a lot about that. So I leveraged talking to the chairman of my department, our CEO, the dean of the university, and said we need to build aesthetic surgery at Johns Hopkins to really truly be the best plastic surgery program in the country. So they're like, we're all in, perfect, you've got the keys to the castle, but you need that background. So I was fortunate to get accepted into Manhattan Eye, Ear, and Throat. Meath has the best aesthetic plastic surgery fellowship in the country, so I was honored to be a fellow in the Upper East Side, and immediately fell in love with New York. So I had a very difficult conversation, called my mentors and said, I'm not coming back, I'm staying here, and decided to open my own practice. And that was several years ago, and we're at 70th and 5th, right next to the Frick, 885th Avenue, and have an amazing team. And again, part of our tripartite mission is we have clinical excellence, we take care of a lot of patients, but then we have an entire research arm with 2 research coordinators because we want to be on the forefront of innovation, treatments, and technology. So again, we have a lot of great collaborations with all the pharma companies and do the newest, for example, we brought the newest Botox that came to market. We were doing the pivotal trials for that. The newest fillers coming to market, we do the clinical trials for that. On Wednesday, I'll be at NASDAQ ringing the bell with a new aesthetics company because we helped them go public out of our practice because of the research and the data that we generated, and then they've been picked up by a company. So we do a lot of innovative things, and then finally education. So when Colette was like, I want you to come out, and she said I had to take a day off. When she told me I'd be staying with them, I was like, yeah, twist my arm really well. We'll find time to connect with some wonderful people. So anyways, just a little quick background on me and my philosophy with what we try to do in our practice.
And that's why I thought to end this speaking series this summer, sort of the final piece, the grand slam, if you would, because there's so much going on. And as we were talking last week's group with just who do you trust, who do you go to, how do you know that this is the right person? And for myself, just so you know how we have been, you've been my doctor now for over 2 years, almost 2 years. I had a traditional procedure that left me with a physical complication. And because I didn't want to lose any more time, you know, in bed with my children, although I have great family members that all pitched in, I was also very nervous. I sort of bought into somebody's image, and I thought he was honest and X, Y, and Z, but the whole point being when Dr. Engelman, who's in Hampton Bays, she's in the Hampton Bays dermatology group, said, I have a doctor, she's great, I have a doctor who I think you should go to. And I said, okay, and I walked into your office, and I'd never experienced a doctor shutting the door and spending 2 hours with me, and coming up with an alternative to surgery, especially in a plastic surgeon's office. And I think part of what's so amazing about Luxurgery is Dr. S's classical training, you know, via Hopkins, etc. He has such a modern twist on what we could do to feel better about ourselves, to maybe look a little better, look a little younger, and we'll talk about all of that. But it was really his sincere bedside manners and coming up with a treatment protocol that worked for me and my family, that won us over to the point where he stayed with us. Maybe we failed to mention there'll be additional kids this weekend, but he didn't. Just kind of kept sneaking them in. But that's what I respect so much about you, is that you took my needs into consideration. And he also sat with my husband when we decided to go ahead with certain treatments, and we could talk about that. He sat with us, and I think it's a rarity, where you are not sitting in a waiting room for an hour, sometimes an hour and a half, but instead spending that time with the doctor and his team. And his team is also, they need to be noted, because I've gotten some of the best facials. I've gotten my PRP, full disclosure PRP treatments, which is the PRP.
Platelet-rich plasma. Platelet-rich plasma. So we draw a little bit of blood, spin it down in the centrifuge, and just use the healthy growth factors and the nutrient-rich part of the blood to use that to basically nourish the skin. So we do microneedling, or one of my assistants does microneedling. We have a few nurses and medical assistants that are trained very well to do some of the more skincare treatments. So they resurface the skin, so use these tiny motorized little microneedles to basically help just strip the superficial layers in a little bit. Think of it like aerating a golf course. We're poking tiny little holes in the skin, putting on some PRP. Yeah, exactly. So aerating the golf course. We're basically poking tiny little holes, really tiny channels into the skin, and then putting the PRP on top, and the skin just soaks up the nutrients that are in there with just 24 hours of being a little pink and a little red. You can do it. No, you can, well, when patients, so some patients who are working on like scars, so I have a lot of my patients that bring their kids and they have bad acne scars. And so you can resurface acne scars with them. It's almost become the gold standard for acne scars. But for just like traditional, when I'm treating mom and now even dad's become a microneedling junkie, there's gonna be interventions here. I heard when he heard that I'm out here lecturing, he put himself on the schedule with one of my staff today, and I was like, there's going to be an intervention when I get home tonight. But the point is that effectively you can do it every month. After you do 3 treatments a month apart, I typically tell patients just do it quarterly, changing in the seasons, because you don't really need to be that aggressive with it. But people see the benefits of it, and their skin looks great, so they're like, how often can I do it? You can do it as often as a month. And the downtime is so minimal that it becomes one of these things where it just becomes a part of their normal routine. So.
Let me ask you some questions.
Yeah.
Yeah.
What about after you have the treatment? What's your well, it might be your global philosophy. Sun exposure?
Sure.
Can you go out or you can't go out, or?
Yeah. So after this weekend, I've really come to realize how exciting and fun the sun exposure could be, but also I've got like one entire arm. Rocco took me out on the water yesterday, and I got one arm that looks like a sleeve right now, red. So my team will love that.
But we had
Scrubs and surgery. So I think fundamentally after that procedure, there's a whole protocol depending on the type of procedure that our team is performing or that I'm performing. After microneedling, because it's not a light or laser-based treatment, your downtime is much less. Lasers and light therapies are phenomenal, but at the right time of the year, and obviously noting what you can do after. So after microneedling and PRP, typically tell patients expect your skin to be a little bit more sensitive for about 3 to 5 days. So you just want to be a bit more aggressive with your sunblocks and making sure it's a physical block as opposed to just like a chemical block. So something that's safer, titanium based, that blocks obviously UVA and UVB, and being really careful about wearing a hat. But that's just because the skin's going to be a little bit more sensitive because we've stripped off some of the more superficial layers and also poked tiny channels that are microscopic in the skin itself. So yeah, after lasers, it's very different. 4 to 6 weeks, making sure, but you're trying to achieve different things. And I think that kind of gets back to what you're saying. So we have a very modern approach. I fundamentally looked at my practice where if you only have a hammer, the whole world is a nail. We've probably all heard that or may have heard that adage before. So what that means is I have so much respect for Dendi who sent us, you know, I helped take care of Dendi. Dendi sends me a lot of patients because she's also somebody who understands what she's capable of doing or a dermatologist capable of doing. But so often a traditional derm practice will try to fix everything they can with basically a syringe or a laser, right? There's a device that's involved in it. Whereas a more traditional plastic surgery practice, like many of some of my mentors in my training, what they were typically doing is saying, oh, well, we only operate, and everything else are for the derms or for the nurses or this and this. And I was like, why isn't there someone who has a modern approach that understands the best of both worlds? Like, why aren't we as surgeons embracing non-surgical modalities because we have that skill set? I understand why a dermatologist shouldn't be doing a lot of complex surgery, which many of them do, and we talk about that on social media, which we can get into, but that makes sense because they haven't been trained in that, so they shouldn't probably be doing it. But for us as plastic surgeons, so often everyone's just been like surgery, surgery, surgery. And so for me, it was so important for us to embrace the full gamut of aesthetics and understand why microneedling and PRP should be part of my practice. Because after I do a great facelift and a neck lift, I want to maintain that outcome, right? I don't want to just say, okay, great, we did some great work, and I'll see you in 10 years for the next one. No, we need to be able to do things to maintain it and get 20 years out of that treatment. And that's something that we've been on the forefront and more progressive about. So when you came in, the most validating thing that you could say is that we spent that time together because I met someone that I didn't know other than just a referral from a doctor that I have a lot of respect for. But you came in and you were in some real duress, right? Like you had an elective procedure that you thought was going to be one thing and were misled into something else happening, which became a complication. And I heard what you said. I've got 2 young kids. I've already lost 7 months or 8 months or however long you were battling with that. And for me to just dismiss that and say, okay, well, the only thing I can do is surgery, because before you met me, you saw the 2 other surgeons, right?
Who said, without a doubt, surgery, and you'll probably recover 3 to 4 months because of the quality of my skin tissue. It almost started to atrophy.
Yeah, right. So it was atrophying. It was there was a lot of certain issues from the complication that was created. And I was like listening to this person who's saying, look, I've got kids, I've got to get back to this, I've got so many other things. Is surgery the only option? And in your situation, it wasn't, but it was because we took a novel approach to using some of the treatments that are out there. And that's what really started to really spawn our research and understanding that we need to be thinking about a very modern approach to aesthetic surgery.
Absolutely.
And that could be non-surgical modality. So a surgeon who understands non-surgical treatments and when to use that area with surgery. And I think that's sort of how this relationship obviously developed, but and from there. And I just want to also say that this is meant to be a really open forum. So even if we're talking about one thing, please, 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 just like you did, this is your time, this is our time to just kind of catch up and dispel myth, talk about certain things, so please don't hesitate to ask questions if they come up, or we'll just kind of continue with our note.
So I was going to say that sort of could lead us beautifully into, so I think the probably 1 or 2 things we all know is Botox, right? Do we do Botox? Should I be doing Botox? When is it too late? What is the age, or can we talk about Botox versus fillers? How do you recommend to someone, for me, full disclosure, I do Botox. I'll admit that, what I haven't done for this favor. But as I say to doctors, I would like a kiss. I don't want to be frozen. I don't want my kids to say, well, is she mad? Oh, she's mad all the time. Is she mad? I can't tell. I wanted movement, but I was starting to feel the effects of having, lived on the West Coast for years and not always been diligent while out at the beach. Also being out in the sun with the girls, but also just wanting to have a little fresher look. And I did what I believe I called the vampire facelift. Is that what PRP is?
Facial.
Facial?
Yeah.
So, and I had, so that's the PRP. So I
You're
had,
taking blood.
yeah, so depending where I always laugh after I leave his office, you look like you have a sunburn. On the Upper East Side, no one would even bat an eye in your direction.
That's a bad courage.
You can literally go have a lovely lunch or dinner at Nello's. No one's even, more people are stitched or ice packed. Only time I had a little moment was I went from your office to Vermont. And I got out of the car and this woman came up and she goes, oh my gosh, what happened? And I said, oh no, you don't look young in this is going to be great in 2 different days. So the downtime is minimal, but I thought it totally changed my skin, the texture, for sure.
Well, like along those lines, I had done an aggressive laser resurfacing on a patient. I did her upper, so just talking about kind of modern approaches, I had one of my patients, and we did her upper lids, and we did her lower lids, but we just took the fat out, whereas traditionally, people would make that cut along the lash line, tuck up and take up too much skin. I said, you know what, we're just gonna laser that skin because it'll give it a shrink wrap effect, so no scar, that'll be visible, but it got rid of the puffy bags. And she's like, well, for lasering that skin, what if we just kind of do the whole face? I go, absolutely, because that will just make everything look great, as we did the whole face and the neck and everything. And I said, listen, you're gonna look kind of like a burn victim for about a week, because we're really going aggressive. Sorry.
So what does that do if you're lasering the whole face? What does it
Just
do?
resurfaces the skin. It basically, think of like a snake losing its old skin. I mean, it just freshens without it looking glossy, without it looking waxy or anything.
So what's the difference between Botox, fillers, whatever?
Perfect.
Love this idea. You're like a planted question. Did you?
No, I didn't.
Right.
Look at your face, you don't smile, you got all this here, right?
Yeah, so we'll talk about, absolutely, right now, after I tell you this little anecdote, I'm gonna tell you about Botox filler. We do a whole injections 101 to help dispel the confusion or the myths. So I basically laser resurface her, she's totally pink, red, everything, and I tell her, just do me a favor and don't leave the house for a few days. Of course, she's feeling great right after, doesn't care that she's red, goes to the market, or on the Upper East Side, goes to a grocery store, and is in there, and this woman comes over to her that works there and says, I'm gonna pray for you. I was like, oh, no, honey, I paid someone to do this to me. She's just like, hey. And a week later when she wetted, when all the redness cleared, her skin started to look great. The woman who works there who was just like really concerned, was like, it worked! She's like, oh my God, Ed, you look better! So she's just like, it was really pretty funny. She's like, I had people praying for me. They're like, really, concerned, but it's just setting expectations. You should be red. But, so to answer your question, what is the difference between Botox and fillers? This whole world of injections has been a huge transition and paradigm shift in the way that we treat faces, and the body for that matter. But let's talk about facial aesthetic injectables. So when we think about the broad term injectables, there's basically 3 categories within that. There are neuromodulators, which I'll get into. There are dermal fillers, and then there are lipolytic or fat dissolving injectables. So 3 broad categories. Let's talk neuromodulators for a second. Neuromodulators or neurotoxins are Botox, Dysport, Xeomin, and the new one called Jeuveau. It's my job to remember all this stuff. But I just wanted to break it down. So if you're not going to know those terms, then you know. So there's no quiz after this, don't worry. So Botox, Dysport, Xeomin, and Jeuveau. Think of all 4 of those as neuromodulators or neurotoxin. So when people say, I just want Botox, Botox has been like the colloquial term, like, hey, Google this, Kleenex that, Xerox that. It was the first one. It was the world's first neurotoxin approved for cosmetic indications. So what do Botox, Dysport, Jeuveau, and Xeomin do? They help relax lines, creases, and wrinkles by basically relaxing the muscle. So what happens is you inject it, and it injects like water, doesn't sting, doesn't burn, anything like that, and you inject it into the crow's feet. You can inject it between the eyebrows, you can inject it in the forehead, and it helps lighten and relax those lines and creases. We can also use it too for patients who, for example, even clench their jaw. So pretty much everyone on my staff, because I'm like, we're seeing patients this Saturday, they're like, okay, I'm like, oh, because we're gonna inject your face now because I don't want to see you make that face. So I treat all of them because I don't want to show them how upset they are when we stay late, because then they're just like, I'm like, you're upset, aren't you? And they're like, yeah. So, teasing. We can do it in a very light way. So you can also inject, for example, the masseter if you're a jaw clencher. So you can treat muscles, neck bands, and neck cords. So there's a lot of different ways to use it. What it basically does when we think about how does this work, it doesn't allow the nerve and the muscle to communicate. So it doesn't cause nerve damage and it doesn't cause muscle damage. But think of it from the perspective of this is our muscle and this is a nerve. We inject Botox. Botox will stay right between the two, and the synapse is what we call it. It's where the neuromuscular junction is. So effectively, when you tell that forehead to go up or create a wrinkle, Botox, your nerve releases a neurotransmitter, and Botox says, no, you guys are not going to communicate for a few weeks or for a few months, depending on how aggressive or the dose. So you don't have to have a frozen face. You can have motion and still get a natural eating Botox. It used to just be done so aggressively that people that got it would just have frozen faces with no emotion. And you don't want that. The natural look is in, and again, in the right hands, you can achieve that because you use a little bit of a less dose, only treat part of the muscle. You can make sure you don't give people kind of that Spock Brown Angry Birds look. You're like, getting a lot of attention there at the bar. I wasn't trying to, but yeah, well, this is brown. But that's a traditional way that people are treating it because they didn't treat the anatomy, right? They didn't treat all the way over, or they weren't treating. So I think there's elegant ways to do these treatments, but that's kind of what Botox is. Typically lasts anywhere from 3 to 6 months, depending on how aggressive one wants to be with it and what one is hoping to achieve. So does that help answer the question about what is Botox? It's a neuromodulator or a neurotoxin is a wrinkle relaxer. The next category over, go ahead, give a question.
I know someone that had actually a mini stroke from Botox.
Okay.
Yeah. That's it.
Okay.
Little accent.
Yeah. How, do you know anything more than that? You would typically not expect that from Botox, but maybe that that would be reportable in medical literature, that the chances that it could have happened from a filler if it was placed in the wrong location, because Botox injects like water. So the way that I could only imagine someone having a stroke from an injection would be if too much was used in the wrong location, like a filler, and it got absorbed, or they injected it into the blood vessel and it went like a blood clot, but instead it was like a filler clot. So that probably happened not from Botox, but maybe from filler.
That could have been the patient and then,
Yeah.
the injection.
No, but I'm saying that could have happened from the injection in a poorly done injection or something like that. But yeah, they're,
You can get Botox on Groupon.
Well, I was just gonna say, I think that's what brings us to, you know, what I really want to convey.
You don't do that.
Yeah,
kind of
no,
thing
for
on
sure.
Groupon. Yes.
So you have Groupon, or you have people having Botox parties, which
Oh,
always
yes,
is
they do it.
And
Everybody does it.
right, and I think everybody should stop.
And they do sit and Botox.
Sit and Botox, well, now
They do that.
we're offering an alternative here, so you can sit and say, and
Right.
go Botox to Dr. S. We're bringing it all full circle.
we'll do sober and Botox.
Right.
Sober and Botox on both parties, on both ends. So talking about safety is a really key element. So I'll close the loop on the fillers and then let's move into keeping people safe, or how to pick the right person. So remember that 3 prongs that we were talking about with injectables. We talked about our neuromodulators. Let's talk about dermal fillers. Yes, ma'am.
Can you tell me what it is, the Botox that you inject into the skin? You said something about water.
Oh, so when Botox, any one of those 4 FDA-approved neurotoxins come in a sterile vial and are basically like freeze-dried powder. So that's what helps them basically stay safe for shipping and things like that. So what we do is we put a little bit of normal saline what we call reconstitute. Think of it almost like decanting, right? You let it open up. So you inject sterile normal saline into the vial, and you let it sit for about 5 to 10 minutes, and now the drug is active. And so then you draw it up like it's normal saline is the same consistency as water. If I had a bottle of normal saline here, you wouldn't be able to tell the difference unless you drank it. Then you'd be like, oh, that's salty. That's normal saline. So that's why I use the normal saline to do it, and that's what you inject with. So it's a consistency of water.
Is there a drug in the saline you said?
No.
It's just saline.
It's just saline. It's sterile saline for injection. So just draw it out of our sterile vials, mix it into the sterile Botox vial, which is basically a powder. Like if you look at it before it injects, it literally just looks like a little bit of powder, and you just let it sit for 5 minutes, and now it's live and ready to be used.
But what's in the powder? What's the
The botulinum toxin. That's the neuromodulator, the neurotoxin, correct. So botulinum toxin, so if you're saying what actually is Botox, so Botox is botulinum, Clostridium botulinum. So it's a bacteria that's been cultured, and you're using the toxin that it basically creates. So I actually just 2 weeks ago, because again of our really good relationships with Allergan, which I don't know for those of you who follow pharma or follow things, just got recently acquired by AbbVie for almost $70 billion. So Botox Allergan's the biggest aesthetic manufacturer. They make Juvederm, they make Kybella, they make Cool Sculpting, they make Botox. That's all enveloped under Allergan. So Allergan's main manufacturing facility for Botox, the entire world's Botox, comes from Ireland. They have a plant there. So I was just flown there to go meet with their chief scientist for the next sort of generation of new Botox and innovation. So I spent 3 days with their head scientists and touring their facility and understanding the regulations on how these things are made. So the point is that they culture it, and the entire world's Botox for 1 year comes out of about 1.5 grams of pure toxin. So you're talking about something that's this big that then gets expanded for millions of people to be treated. So when that Botox is manufactured and transported, it's done that with like the highest security detail you could imagine. If someone got their hands on just that 1.5 pure, you could like take out a whole city or something. So the point is that they take it and then it's expanded from the purified, sterile, safe toxin. So it's what used to create botulism. When you think about it, it was botulism. So people would die from paralysis from botulism. It was that protein that created that problem.
I think that goes back to what you were saying is you really need to know who's doing your Botox. So I'm not a fan of the Botox party or my ophthalmologist saying on Tuesday his office will be featuring a nurse who could do the Botox. I feel strongly that it is safety first, and a doctor who will really sort of give you that look, the non-frozen or the angry bird. But I think your question was more around the mouth, and do we?
Yeah. Which takes us into the filler discussion. So those dermal fillers are the second category, and there are several. So I'm going to just throw out a bunch of names because you may have heard of one of them, but again, there's no pop quiz. So there's something like called, of course, Restylane. Restylane is an entire family of fillers made by a different company. So there's Restylane Lift, Restylane Classic, Restylane Silk, Restylane Refine, and Restylane Define. Okay, so there's 5 Restylane products. When people come into my office and say, oh, I had Restylane 2 years ago, I'm like, which one? They're like, is there another one? I'm like, that's okay. That's, again, my job. So that's Restylane. You may have heard of Juvederm. There's Juvederm Voluma, Juvederm Ultra, Juvederm Ultra Plus, Juvederm Volure, and Juvederm Volbella, right? So there's 5 Juvederm products that are FDA approved. Then there's Radix. There's Sculptra, there's Bellatero, there's Versa. I wasn't kidding when I said there's an explosion of these products, which is why it's so important to be in the hands of someone that knows what they are. Because if we had a room full of clinicians right now, you'd be hard pressed if half of them knew what's FDA approved and how to use every single one of them. But if you're, for example, a practice like ours, where we actually help develop them, you know the subtle nuances. And I'm glad there's that many, because as an artist, you want to have multiple paints, right? You want to have a lot of different color because you want to know what each one of them does. But if you're somebody who's like, I'm only going to use red, blue, and green, which is primary colors or whatever it is, that becomes an issue because then you're just doing a paint by numbers type of outcome as opposed to a very focused, and a very harmonious face. So that's what fillers are, and I'll explain how they work. But you had a quick question.
Yes.
Yes, ma'am.
How do you decide which patient needs, which, baby, which filler, what type?
Exactly. It's all based on the anatomy. So for example, I know that if someone's flattened out and lost a lot of volume in their cheeks, and we just need to create a little bit of cheekbone volume there, 8 of those fillers are not a good option because they aren't necessarily thick enough, or they don't have the longevity, or they're too watery. They're better off for maybe fine lines like what we call the barcodes around the lips, something like that. So you use the wrong part, the wrong place. If I use this fine line one here in the cheek, it's going to be a drop in the ocean. Like, you're not going to be able to create the volume. On the opposite, if you use the one that you use to really lift and create some volume and structure, and you put that here, they're going to be walking around with a sausage on their face. Because I'm not naming names, so you said it, not me. That's okay. It's okay.
Yeah, and it was a terrible look.
Oh.
In my opinion, I didn't say that.
So there you go. Great question. So the answer is, the question was, are those things reversible? So within the family of dermal fillers, okay, the lion's share of them are made out of hyaluronic acid, which sounds scary, but it's not. You have hyaluronic acid on the tip of your toe all the way up to your hair. It is a complex sugar that is made in our bodies to help lock in and absorb fluid. So it keeps us plump, it keeps us, so you can't buy a skincare product these days that doesn't have HA or hyaluronic acid. Well, this is actually synthetic medical grade hyaluronic acid that is totally biocompatible, so it absorbs in and it doesn't encase like a foreign body. When you inject it the right way, the body will absorb it, and you're basically replenishing things that have been lost with a safe filler. So Juvederm and Restylane are all hyaluronic acid gel fillers. So if you inject them, they inject like a gel. And the difference between them could be one's a bit more watery, one's a bit more thick, and that's what dictates where we're going to use what, and that's, again, the responsibility of a good clinician. Hyaluronic acid gel fillers are reversible. If there's a complication, if there's too much used, if we're not happy with the outcome, you can inject an enzyme called hyaluronidase. Well, you can't. I would inject an enzyme called hyaluronidase, which will immediately digest and dissolve the filler without affecting the surrounding tissue. So it's a very safe thing to be able to use because you can use it to break down the filler immediately.
Why would that actress not have done something? She liked it.
Well, I think one of two things. So again, it's either A, she liked it, or B, you're surrounded by enough people that tell you it looks great because they just tell you what you want to hear. Or the same reason why there are people that walk around my neighborhood at 70th and 5th with a facelift that looks like they're windblown, right? I look outside my office sometimes, I'm like, either she's running really fast, there's a tornado in Central Park, and I'm like, she's walking around like this, and the treetops aren't moving. So someone thought that it was a great idea, and why is that person thought that was a good idea? Well, they're in the hands of someone that's what that person created, right? And sometimes, one's reputation gets perpetuated in a certain way. We should only go to this person. Oh, you're doing it, you should only do this. And all of a sudden, that person over and over and over just creates the same type of face, with the same type of nose, with the same type of lips. And people will flock to it for whatever their reasons are, only later to find out that was such a bad idea. So in the surgery world, that can be a complex thing to fix, which again, we were able to do in a lot of ways. But in the filler, Botox world, typically there's a quicker antidote for that, but it's also understanding the aesthetic of why you pick the clinician that you pick, which we'll get into in terms of safety after we close the loop on the fillers.
How long do fillers typically last?
Great question. Fillers typically last anywhere from 10 months up to 2 years, depending on which filler that one uses. So again, it's all about understanding the gel and the science behind it. And remember, not every filler is hyaluronic acid gel. There are fillers like Radiesse that are calcium based. So for example, they almost inject like liquid bone. That's safe and appropriate to use, but they may last 2 to 3 years, so they're semi-permanent. and they take a long time to go away, but there's no reversal for it. Exactly. So there are different fillers. 99% of what we use in our practice is going to be a hyaluronic acid gel filler in someone's face, because we want to know that we've got the safety profile, and there's so much more versatility within that entire palette of different types of fillers that we can safely use. Yes, ma'am.
What about allergies to some of these products?
Great question. So the lion's share of them, so well, the good thing is because they are non-animal, non-human derived, they typically don't truly, it's rare that someone actually gets an allergy to them. Botox, in worldwide, in a single year, you could probably count on maybe worldwide, mind you, millions of people being injected, less than probably 10 to 20 people worldwide may get some type of allergic reaction. And that's typically because all the Botox to be stabilized has a component of salts called, in this situation, is HSA, human serum albumin. So they have to use a protein to stabilize it. And it's not like whether you're using human albumin, what could something happen? If you knew the sheer number of medications that have albumins to stabilize them, it's like a ridiculous percentage of them. So it's not something that's only exclusive to Botox. If you've taken medicine in the last 20 years of your life, you've taken your human serum albumin. So it's very rare that you actually get an allergic reaction. The adverse events or complications are typically more related to injection technique, injection location, and product selection. So it's all about the anatomy and the injector. Fillers are very safe in that capacity. You rarely get an allergic reaction again because they've been stripped of the proteins in the synthetic way that they're made. Because they're non-animal, non-human derived, it's not like the flu shot, which people can get what we call serum sickness because it's mixed with horse, like like an equine albumin or rooster combs or things like that, which is what the collagen. Well, that's what collagen injections are. If you think about back to 30 years ago, before we started using all these HAs, collagen injections required allergic testing first, because the protein that they were extracted from was either bovine or rooster comb. So it was either bovine or fowl or avian derived. So you did an allergic spot test, waited a month to see if you had a complication, and then you had to come back and then get treated, because 10 or 20% of people were exposed at some point in their life with an older, with a smallpox virus or something that was mixed with them, so they were sensitized. So all of that has now gone out the window, which tells us how safe things have gotten in the last 15 to 20 years. But it wasn't that long ago that we were still using collagen injections and having to do skin testing. So you don't really have those allergic reactions anymore because they're not derived from them. They're synthetically made to mimic what's happening in us, and they don't have animal proteins with them. So great question.
I was just going to say, if I may, only because I know we are a little limited on time because the theater group is packed, which is great news, and they will be using this room, but I had gotten a few emails and I want to be sure we sort of touch on a bunch. I'm also going to pass around a notebook. If you would add your email, I'm going to forward it on to Dr. S's office manager, who will be sending out a informative email, but also a promotion if you'd like to go into his office for further consult. But we're speaking so much about safety, which I appreciate you bringing it up because it was in my notes, and truth. And in today, where there's so much happening via social media, there's so many, well, what about this? And do I do Botox or do I do fill? Is this gonna get rid of the cellulite? Do we freeze the fat or do we burn the fat? And all of these questions, so I wanna be sure to maybe even segue towards what are some other safety, or approved by, I'm sorry, do you have a question?
I had a question for the
Yeah.
doctor. It strikes me that, are there ever cases where you tell someone, I'm not going to do something, I'm not going to do that, what you want is either unrealistic, unsafe, whatever? Does that happen?
So my mentor at Johns Hopkins was the chairman of the Department of Plastic Surgery, and he took a liking to me. I was very young, obviously, when I started, so he almost looked at me like his son. And I became really close with him, and he taught me a very valuable lesson. He says, Sachin, when you get to New York, because you're going to make a great living based on who you take care of, but you're going to build your reputation very quickly based on who you say no to. And that has resonated with me to this day. We get people who come in with unreasonable expectations, or have unreasonable requests, or who aren't emotionally at a place where it's appropriate to do a certain type of treatment because maybe their motivations are wrong or all these things, and we say no. I don't.
Is that what you figure out in the hour and a half or the time that you?
100%. That's why I do all my consults. I have my team with me taking notes, but I don't run a practice where my consultations are done by my practice manager or by my nurses,
Right.
and then I just show up to finalize the plan. The first thing that happens, even as you do, we sat in my office and we talked, like, what brings you here? What's on your mind? When did you start thinking about wanting to have that procedure? Why now? Why is now a great time for you to have that? You told me to think about it for 20 years. What happened recently? Or you just told me to start thinking about this last month. Well, why now? So that's a conversation that we only can have when we're sitting and talking like two friends, as opposed to, okay, you're here, you need a facelift, okay, let's get that booked. And that's it. No,
And how much do you want to screen?
So it's a great question, and I think that's where I think our practice has really thrived in a short period of time. So you're looking at it like, man, it looks kind of young. I'm actually 70, I do a bit I finish these things, but for me, I wanted to create a different feel, a different type of approach where you actually like foster a good relationship in that way. We don't run our practice like Grand Central Station.
Right.
So it's important for me to like connect and understand the motivations and all those types of things. So
And
yes,
you
it's
also
no.
do some kind of a, I don't know, transformational, computer-generated.
The morphing type of software.
Yes.
So we use a lot of digital images and a lot of things to help people understand what we're going
What's
to
going
do.
to happen.
But I
Yes.
do not use the morphing software for one reason in particular. And a lot of my colleagues have gotten away from it because number one, it's a great marketing tool,
Yeah.
but what I can do in the convenience of my office with my laptop is not necessarily what's gonna happen on the table. So
Right.
people walk away saying, well, that's how my nose is gonna look, or that's how the nose is, that's how the face is gonna look, that's how I'm going to look great. And now they've got a digital image of that and expecting that. And you know what? The body never behaves the way that the computer tells it to.
Right.
So we have to understand expectations. That's why it's so important to pick someone who's aligned with what your ideal aesthetic is. That's why I say all the time, like, look at the office staff, right? Is that your idea? Like, are you in the right place based on what you see? If you see someone walking around with breasts out to here, or lips like this, or pushing, like, that's that doctor's idea of a great look. Whereas if you look at their team and you're like, okay, this is, and maybe for example, maybe you are in the right place. Maybe that's what you're looking to achieve. Great, you found your office that you belong there. Whereas other places you may want a more understated look or different things. So understanding the ideals that I think too often people come into an office and they think just because they've sat in the chair for a consult that they now have to get treated. And I'm like, you know what? Go see 5 other people, make sure I'm a good fit. When patients start asking me like, oh, well, you look so young, or how many have you done, or different things, I'm like, that's a great question, and the same way you're interviewing me to decide if I should be your doctor, I'm actually interviewing you to see if I want to be your friend for the next year. Because if we do this operation, we're going to be working very closely together, and if you're not pleasant, or you don't have our idea, we're going to be just fine if we don't do your surgery. And here is my competitor's card. So I want you to see them, because I think they can make you happier, and you can torture
Does this
them.
mean you like me?
It does.
I would, quick
Yes,
question.
we'll come, we will
Okay,
not,
sorry.
we'll come to you, yeah, absolutely.
Do you notice, just a general, well, one is, do you use your do you have things done to your skin? Because it looks great.
Thank you.
Also, are more men, I mean, we're all women, Jack, I'm sorry, you're here, but we're all women here. Do you find more men getting treatments nowadays? And is that a new niche market?
Great question. Number one, yes. I get microneedling and PRP. I travel all over the world.
Right.
I get off of a plane and need to be fresh and seeing patients, or I get off a plane and need to be able to lecture, and I'll a 16-hour flight to Asia, get off at 5 a.m. and be on podium at 8 a.m. in front of 700 people. So absolutely, I need to look fresh. I do very minimally invasive things like the microneedling and PRP, do the occasional micro laser peel, where the team will just do a very light laser just to keep things fresh. So I'm big on skincare for me, because I don't think I don't need Botox right now in that standpoint. I don't need fillers. I have a round face, so I've got enough volume in there. I can thank my mother for that. So it's just keeping me looking, a youthful face is a round face. I keep telling myself that. But yeah, so there's, yeah, exactly. So there are certain things that what I need, I'm not afraid to have those appropriate treatments to keep me looking fresh and to keep me looking good. So that's number one. As far as the male question is concerned, so that would tie into the third injection that we didn't finish, which is the lipolytic or adipocyte litigation. Kybella, which is the world's only FDA-approved permanent fat dissolving injection. We created an entire practice around what we call surgery in a syringe, because you can get a liposuction type outcome, but without having to have surgery in specific areas. There's some caveats to it. That's a different conversation in its own right to keep things moving along. But the fact is when I introduced Kybella into my practice, we have the largest experience with it in the world. One of the things that we noticed immediately was the sheer number of men that came in because they didn't want the stigma of cosmetic surgery, but wanted to be able to get rid of fat in a strategic location, especially in the neck. It was FDA approved for the double chin area. And so, and men coming in who would be like, I want that new Botox thing here. I was like, well, it's not Botox, it's called Kybella. Yeah, that Jupiter thing you put on my girlfriend's lips, it looks great. Inject that here. It's like, I would make a double chin. I don't know what it's called. I read about it. Heard it gets rid of fat. Let's get going. And it's not surgery. I can tell everyone I never had surgery, right? It's like, no surgery, there's no scars, it's gonna be fine. It's okay, we can do this. And so all of a sudden, so right now my practice, about 30 to 40% of my patient practice is comprised of men. And guys in finance that need to like feel fresh or look better, people in entertainment, everyday guys. I've NYPD officers that come in that are like, if you tell anyone. So we've cultivated, and if you were ever in the city, you saw our practice. I think one of the things you realize, we've cultivated an ambiance and an experience that taps into men and women. We want our female patients to feel comfortable in their own right. So patients are never actually even seeing each other. Like you rarely have you probably ever sat? Like we have an entire schedule. This person's gonna be pathway to this room, this one's pathway here. People are meant to have privacy and environment. So I don't have a guy sitting in the reception area while 5 other women come in and he's like, oh geez, you know what's gonna happen. You're like, it feels so awkward. No, create a good experience, make it a safe feeling, because that's what I want for all of our patients. But yes, men, a lot of men come in.
And just to go, because you were with the kids all weekend.
Yeah.
Do you have to start all this early? Like, is it ever too late or is it ever too soon?
Yeah, so we do baby Botox. We start as early as 2 years. You should see Lexi. She looks amazing. So the answer is, you know, there are certain procedures that I think it's more about emotional maturity and treating the anatomy, right? So I've got 25-year-olds that come in that have skin that's flopping over their eyelids. Am I going to make this person wait until they're 50? That's not appropriate, right? But I also have a 14-year-old that comes in and mom's driving the conversation or dad's driving the conversation, and I'm like, this dynamic is not good. This is not being generated by this child. This is not a good idea at this time. So we're not going to get involved and do this to answer your question. So it has to be, but for the lion's share of things, most patients in their 20s and 30s, or 30s, yes, a little bit. Most patients in their 20s do not need any filler. They may want Kybella because you have the marathon runner that has a little genetic predisposition to a little pouch so they can get that treatment and have a nice jawline. No harm, no foul. You can do some preventative Botox so you don't get the deeper lines and creases. You don't need to freeze the face, but you can do strategic amounts to relax those muscles so one will mature, because no one ages in our practice, they mature, right? So they mature gracefully at that standpoint. So the fact is that from an age, it's all about maturity and anatomy and understanding what's the secondary gain. And I think that's important.
Thank you.
Yeah, of course. You had, sorry, one second, she had this question I want to forget.
I was just curious, this, what options are there for that? Just not,
Sure, that is the main option depending on where one gets to. So I'm all about, you know, if you try to address the upper eyelid, what she was pointing to was some little bit of upper eyelid, extra eyelid skin. If you try to address that with only Botox or neurotoxin, for example, that's what creates the angry bird, because you're really trying to like get this brow to lift up to take tension off of it. If you use fillers here, right? It's gonna make it like Cro-Magnon because it's gonna bulk it up. The gold standard, it's like, heaven forbid anyone ever has surgery anymore, right? Like, that's the gold standard in that capacity. And you look at, last year in this country, 86% of cosmetic procedures performed in the United States were non-surgical, okay? We can do amazing things non-surgically in the right hands, but guess what? Every so often you may actually have to remove some skin, and that's where appropriate surgery and all of those things come
And is
into
there a point
play.
at which it becomes medically necessary, so they would pick?
Yeah, so usually if someone has what we call, if they've got a failed visual field exam, so if you do a visual field exam and all those things, and it impedes vision, that's about the only indication where you can get someone else to cover it from that standpoint. So you have to do a visual field exam. It's the same thing with like breast reduction surgery or other procedures. Fine, you can go to, I have patients that come in, they're like, well, can insurance cover this? It can. You need to get an orthopedic spine surgeon to sign off on it. You need 2 years of physical therapy, and they'll mandate a certain amount of tissue to be reduced. Well, if you don't want that much reduced, you can either have a mastectomy and get all of that out, which is terrible, right? Meaning that you're literally telling, an insurance company is telling you, take out 600 grams. Well, she doesn't need 600 grams, but it still causes back pain, neck pain, and emotional duress and all these things. So there's a whole different back end. I never want an insurance company to tell me what I have to do. I need to be the doctor. You sitting and pushing paper and doesn't dictate it. But that's how that's healthcare would be another conversation. We can make that
4 hours.
You had a question.
I want to ask you about Fraxel, because we were talking about looking red, like baby's rash, and walking around with a burning face, but the peel is wonderful. It takes away all the brown spots and all the little lines.
Are you talking about with Fraxel?
Fraxel, yeah.
So Fraxel, much like Botox, right, has become I was just going to say it becomes kind of the colloquial term of using a fractionated laser. So Fraxel was kind of the first one to come out, and where Fraxel basically developed from were the aggressive CO2 lasers, where people could have 6, 8, 10 weeks of downtime 15 or 20 years ago. They just really looked burned and could have some problems. So what people started to do is realize you could use a fractionated laser, and what that means is the laser fires every other tenth of a millimeter. So it spares a little bit of skin, but injects a little bit of skin. Spares a little bit of skin, injects, so it's like tiny little dots. And it keeps healthy part, unhealthy part, and then it kind of all heals. So a fractionated laser is a very good option for, again, resurfacing without giving someone the waxy kind of face look, and to get rid of a lot of sun damage, to work again on the fine lines, creases, wrinkles, and you get some tightening from it as well, with less downtime, because you're using a fractionated technology, which again means it's just every other little tiny dot. Think of it kind of like the microneedling, or again, aerating the golf course. Some of the grass is okay, or some of the greens are okay, but then some of them have a hole in it, and you're doing that at a microscopic level. So that is a very, very good option in that standpoint. But there are a lot of really great lasers. It was just Fraxel is the first one to start doing the fractionated thing, so people just say Fraxel, but there's a whole group of
I did that
fractionated
number
lasers.
gets gone, just wanted
Yeah.
ladies to hear.
Oh, yes.
Just a quick one. What about all the promises that the creams and the gels and the marketing? I mean, I've gone through so many different bottles, I'm sure we all have, and some that promise the hyaluronic acid. Is it a waste of money?
Great question. So the world of lotions and potions, right, can be a very daunting one to navigate and intimidating. I think ultimately it's because you've got to work with professional grade products. A lot of the products that the normal consumer can buy are basically going to promise certain things or have hyaluronic acid, but at what concentration, right? So what they do is, even if you go and buy La Mer, right? Your La Mer, for example, will be out there on the product market, they'll have HA, but either it's not medical grade at the same level of a prescription type, or it doesn't have enough of a hyaluronic acid concentration, because then that would require a medical professional to prescribe it. And so, again, I think a good skincare regimen, number one, has to be done religiously. And that is one big part of it, is do people use it the right way and use it consistently. The second part of it is that it needs to have at least some type of retinoid at appropriate concentration to be able to actually cause the cells to turn over. So people will say, okay, well then mine has retin-A in it. but it's not at a high enough concentration. It's a good marketing one from Shiseido or something like that, where all of a sudden you don't have enough of a concentration of the drug to create a nice change. In the right hands with the right skincare regimen used appropriately, your skin, that you couldn't do a better thing than daily using the right skincare regimen. But it is a work in progress. Like, you've got to be able to stick with it. So that's where, again, being in the right practice, whether it's out here, whether it's in the city, whatever it is, whoever you choose to work with, needs to understand your skin type and what's going to actually make a difference and what the goals are. But yes, it can make a big difference. But it's, so don't lose faith, don't lose hope. But there's so many people that will be like, I mean, I've had patients come to our office like, wait, the skincare only costs that much? I was like, yeah, you don't need to be buying thousands of dollars of skincare over the counter at Saks in order to get the outcome. In fact, throw all that stuff away, give it away, whatever it is. This basic thing will make a change. And 6 months later, they're like, my skin's never looked this good, but because you're actually on prescription strength, professional grade skincare.
That's good to hear.
Yeah, so
And I
don't
will
lose hope.
say, not just because you're sitting with us, Dr. S's nurse, we performed the PRP, and she would then say, well, what products are you now using? And I was using probably the most expensive from Saks, and she said, would you try this line? It was a third of the price of La Mer, and within 2 months, actually, I had gotten rid of all my other products. And what was interesting about this line that she recommended, it has a shelf life. So the vitamins in it actually start to lose their, which a lot of those creams, they don't. No one at Saks is saying, oh, in 6 months, throw your 400 bottle of La Mer eye cream away because it's no longer. So I think that's very true, is the routine, the
peptides,
product.
the protein,
Yes,
everything, and
100%.
actually, they're medications.
Yes.
Just in an appropriate way. It's not, people something, I want to take medicine, all natural. I understand those components, those vitamins, those minerals, those growth factors, all do have a shelf life on them. And I think it's important to understand that, because that's what's telling you that they have active materials in them that will work.
Right.
Rather than it just being like, and that's why we also don't just carry and stock 50 bottles of it. It's like we curate a plan, or she'll curate that plan specifically for the person to, okay, this is your skin type, this is your oil concentrate, all those different things, which makes a difference. So answer your question.
One more question. I know we're a little short on time, but we'll take the 2 questions for
Yes,
sure.
she had two.
What line was that?
What line was I using?
Yeah.
I was using La Mer.
La Mer, but I mean,
Yeah.
what was the one that she recommended? Was that one that you created
Oh,
yourself?
yeah, well, it's one that so number one, no, I wish I could take credit for
Okay.
creating it. We're good at a lot of things, I'm not a compounder, so I know my limitations. I think it was very good, my dad is a cardiologist, ingrained in me a long time ago, know your strengths and know your weaknesses, right? So, and my mom for that matter, but basically, so we use a product line called Environ, and then another one through Allergan called Skin Medica. And they actually have just great data and great science. And then finally, Elastin. There's those three in my opinion do great work. And I wish I could take credit for development, but I can't. But I know what we do well and what we don't.
Right.
And I'm not compounding those and trying to put my label on it and sell it to people. That's not what I do. So I want to use the stuff that people have spent 30 years developing and do a good job.
Environ
Mm-hmm.
and
Skin Medica
Skin Medica.
and Elastin. And those are different brand names, and within them there's different lines, so it can be very overwhelming. Again, each depending on what the person's needs are, their skin tone, or trying to lighten areas, or hyperpigmentation from something else, different things can be curated to basically do that. That's why my team's so great, because again, I know what I'm good at and what I'm not good at. And me sitting down for 2 hours doing what I joke with call a lotion potion consult, that's what they're great at, because they eat, breathe, and live skincare. I send them to courses literally every quarter. They're at a seminar, when I'm lecturing at one of our national meetings, I register them for all the skincare stuff, and they've got like assignments and homework because we eat, breathe, and live what we do. Yeah. Yes, ma'am.
Amylactin.
Pardon me?
Amylactin. Can you tell us about amylactin?
I don't think so.
Solution.
Not- Oh, okay. When I get your email, we can have someone look into it, I can send you, but I'm not.
I've heard that there is a dry skin.
Okay,
My husband was having something one time.
okay,
They recommended Environ.
Yeah.
got it.
A lot of the dermatologists do.
Sure.
How about that starting?
And there's so many, so that's
Yeah.
great to know, because I just don't know that one in particular, but I can certainly look
You're
into it.
just a
and get
little
back to
bit
you.
too young to know that it is been out for a very long time.
Oh, is that right? Not that, I told you I'm 70, I've got.
What do you put on Scarlet?
On what, sorry?
Strivectin?
Strivectin?
Because the lines.
Okay. I'm gonna have to look at that one too. I don't know what's Strivectin. I'm not sure what's Strivectin.
It's another
Yeah, I was gonna say, you can't do that.
Okay. We may have, if, you know, and there's nothing wrong with an oldie being a goodie, so that's okay,
Yes,
but
yes.
it's not something that we're typically using a lot in our practice, so I wouldn't be able to tell you in that way.
Yes, a program in the field, and their whole line, which is supposedly dermatologists.
Yeah, I think that they create some great products in general, but again, I think that when we're really looking at trying to curate a medical grade one, you know, there's certain elements of it that are stripped out because of the growth, again, the growth factors and, pardon me, what'd you say? Yeah, no, I was just saying, yeah, sorry, I didn't know you. But yeah, so because of just the way that those are all curated and built, and I think they've done a great job with marketing, like Proactive, right? So Proactive, they've got a celebrity and everyone's no acne and all these things, and a lot of that becomes just these huge marketing pushes and ploys because they want to blow it out there in the world. Some of these companies you've never even heard of because they're so focused on the science and less on the marketing that they just want the reputation of being great products in a medical practice. They don't care about being sold to the masses or on like QVC or different things like that because they're so focused on science. And that I think is important to me from what we're going to be putting on our patients to maintain the surgical work that we do or the injections that we do or things like that.
Just the last question. Yes, please.
Really quick, I want you to actually go back a little bit. You had mentioned an injectable for like a pouch under the chin that is non-surgical.
Kybella.
Kybella.
So Kybella is also made by Allergan, that company that makes the Botox and the Juvederm, the cool sculpting and all those things. So Kybella, Kybella. Kybella is the world's only FDA-approved permanent fat dissolving injection.
Oh,
and
fat dissolving.
And so the process of breaking down the fat, it often will also tighten up the skin quite a bit because it's creating a chemical reaction with the active ingredient of it's found in all of our bodies.
I just think the satellite office.
Yeah.
We're working on lots of things here, but never underestimate what I have.
I don't think my team will argue with having to come out and.
Probably not. Yeah, right. Yeah, kind of, well, winter's okay.
No, winter's fabulous, and we're working through all, but I know Snow White and her dwarfs are going to be happy. So I wanted to say thank you because this has been an incredible session. And to remind everyone that please sign the email list, and Anna Lucia will send a follow-up email with a wonderful promotion Dr. S's office is going to be offering if you came today, and only if you came today. But also don't forget to buy your tickets for Friday night's fundraising gala because a lot of exciting things are going to be spoken about and shared, and there's so much more to come to these moments. Thank you.
I would just take 2 seconds, if you don't mind, 10 seconds, maybe a little bit more than that, to just number one, thank all of you for your interest in wanting to like understand or learn more, because I think it's so important to be an informed patient and not just be guided by social media or different myths out there or different things. Like you want to basically be in the hands of someone that eats, breathes, and lives this, right? So again, as a cardiologist, my dad, who's now basically retired, would say, oh, well, you know, you're so busy, maybe I'll just learn how to inject like Kybella because you've done more anywhere in the world. And I said, you know what? If your patients were having a heart attack, they probably wouldn't come to the plastic surgeon's office. My patients don't come to my Fifth Avenue office to see a cardiologist, who just kind of laughed. But then when you actually spend time learning about what it is that I'm doing, and the fact that I've spent 10 years of my life learning how to do it, it's like, this is not as simple as just sticking a few needles in. So dealing with a doctor or a nurse or someone who's in a certain twilight of their career or whose reimbursements have been slashed because of Medicare or because of insurance, and all of a sudden they just want to figure out, okay, well, you know what, I don't want to do eye exams anymore, or doing this isn't as fruitful and it's easier to do a little bit of Botox. Maybe that's not the right person. All MDs aren't created the same, and within the world of plastic surgery, not all plastic surgeons are created the same. Go and get tons of opinions, understand, do the consults, recognize who is willing to like help take care of you. When patients when I practice say, well, you know, I hope you don't mind me get another opinion, I'm like, please go get 5 more. Make sure that when you come back here, because I want you to feel like I'm the best person in the world to help take care of you. And if you find someone that's doing that you think would do better, all I ask is just give us feedback so we understand why, so we can do better. So I think you should never feel obligated, you should never feel pressured. You have to be the right environment that facilitates your aesthetic. So I applaud all of you for coming, but more importantly, thank you for putting this together.